Diarrhea and constipation. Diarrhea is the abnormal passage of stools with increased frequency, increased water in it. It's very fluid, and it usually weighs more. It weighs more. Because the stool is moving so quickly through this system, it doesn't have a chance to absorb the water and electrolytes back into the circulation. So we have serious fluid and electrolyte imbalances, especially if this diarrhea continues day after day. It can be caused by irritants in the GI tract, hormonal imbalances, abnormal neural stimulation, medications, tumors, and lots of other things. As we can see on this slide, we can treat it with medications. The first classification is adsorbents. They coat the walls of the GI tract and they bind to the causative bacteria or toxin, which is then bound up and eliminated from the body and can't cause any further damage. Examples of this are Pepto-Bismol and kaopectate. The second classification of medications for diarrhea is antimotility. They decrease the peristalsis of the GI tract. That means everything slows down. That means there's more time for water and electrolytes to be absorbed. Third class is antibiotics. Here we are directly trying to hit on what it is that's causing the problem. And the pathogens are causing an inflammation, so let the antibiotics respond to decrease that inflammation. Therefore, there's decreased fluid movement into the intestines. The next category is intestinal flora modifiers. This is the probiotics or bacterial replacement drugs. It includes yogurt, Activia, that kind of thing. They're very popular. You hear them all the time on television these days. They supply the missing bacteria to the GI tract, thereby suppressing the growth of the diarrhea-causing bacteria. Now, drugs are not the only answer. We can do things with people's diets. There's the brat diet, encouraging people to completely rest their GI system as much as possible and have a diet of just bananas, rice, applesauce, and toast for a couple days. But we need to make sure they've got adequate fluid intake. We're looking at their hydration status, and if this diarrhea is severe enough that they're in the hospital, we're obviously doing I&O. A word of warning: do not give bismuth subsalicylate, which is Pepto-Bismol, to children or teenagers with chicken pox, because there's a risk of Reye's syndrome, another disease. Constipation. Constipation is a symptom, not a disease. It is an abnormally infrequent and difficult passage of feces. It's a disorder of movement through the colon and or rectum, and it can be caused by a variety of diseases and medications. We've got medications for it, such as bulk-forming laxatives, which are high in fiber. They work by absorbing water into the GI tract to increase the bulk of the stool. So the stool is increasing in size, but it's doing it by getting wetter and softer. It also distends the bowel to initiate the reflex bowel activity, to initiate that peristalsis. Examples are psyllium or metamucil, methylcellulose, which is Citracel, and polycarbophil. The next class is emollients, which are stool softeners or lubricants. They promote more water and fat into the stools to lubricate the fecal material. These are the stool softeners like Ducasate, Colase, Surfac, and lubricants such as mineral oil. We have a group of drugs that are hyperosmotic, and sometimes we call them saline laxatives. They increase the fecal water content. This means, again, we've got more water in the stool. It's larger. It will trigger peristalsis. It's softer. Examples are polyethylene glycol, sorbitol, glycerin, magnesium sulfate, which is Epsom salt, milk of magnesia, and the Fleet's enemas. Lastly, we've got the stimulants. These increase peristalsis by increasing the nerve stimulation. Castor oil, senna, cascara, bisacato. Now, laxatives can have adverse effects, and they depend on the type, but all laxatives can cause electrolyte imbalances. We're going to encourage people to have exercise, high dietary fiber, and an adequate fluid intake to try and prevent the problem. We're going to be assessing fluid and electrolytes, and we have to remember that long-term use of laxatives often result in decreased bowel tone and can lead to dependency. This is a major problem, especially in the older population.